I have had 4 cheek implant revisions, but finally removed them. Will I have a problem switching to fillers given the scar tissue? 4 different styles over a period of 25 years. I was happy with them when I was younger, but as I aged, I tried a couple of smaller styles, but they still looked too large and unnatural. I have scar tissue now from all of the surgery. Will a filler be able to be injected evenly? Will I be able to get a good result? I naturally have very flat cheeks and hate the idea of having nothing at all. Thanks in advance.
Thank you for your question. You have submitted a question without any photos. However, you state in this question that you have undergone 4 separate surgical revisions for cheek implants over the course of 25 years. And essentially the challenge that you're facing is that subsequent surgeries still resulted in the implants looking too large and not looking right for your face. So now that you don't have these implants, you want to know, can you have fillers, or is the scar tissue going to be problematic? Well, I can certainly provide you with some guidance, even in the absence of a photo, from my experience with comparable situations in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform facial implants fairly routinely, as well as provide non-surgical solutions such as something called structural volumizing that provides comparable results, and I think I can give you some understanding of what your options can be. So to begin with, yes, there is certainly a known issue with any type of facial implant, particularly in the mid-face, in the cheek area, as one gets older. It's become clearly more well-defined in the medical literature that facial aging is particularly characterized by a change in bone structure volume. And bone loss is important as part of the foundation in what the facial overlying can look like. So when you appreciate that not only is the bone loss significant, but then the soft tissue gets thinner as we get older, that means the skin, the fat, the muscle. Understanding all that, it is certainly understandable how you went through this path. Now, as far as the considerations of scar tissue are concerned, certainly it is something that as any doctor doing this would be concerned about. And I would have to say that there is, from my perspective, speaking as a surgeon, there is a certain advantage to a surgeon who does this type of surgery to understand the planes that are involved when you're placing a filler, understanding that there was previous surgery. When we do a procedure called structural volumizing, we actually place the filler at a level that is comparable to the level that a cheek implant is placed. And so it's placed at the bone level between the bone and the muscle. And that way the filler fills the void and the deficit that is necessary to create projection and give the person nice looking cheeks. That being said, although this is a technical aspect that may be relevant, and it still doesn't mean that there hasn't been any changes anatomically from repeat surgeries. But there is a layer over the bone called the periosteum. It's a very tight sheet that is connected to the bone, over the bone. When you place a facial implant, the periosteum is lifted away and the implant is placed on the bone. And then the periosteum is redraped. When you are placing filler, you are not going below at that same level. So that could be the space which has the majority of this scar tissue. And conceptually, it's possible that the tissue above the periosteum may be relatively have limited impact from the previous surgery. Now, that doesn't mean that the surgeons previously may have, as part of the procedure, crossed those boundaries as just par for the course of doing in the process of doing surgery. But I think I would say that in my hands, when I treat somebody who has a similar history, I can usually tell using the methods of using these blunt instruments called blunt cannulas at the level between the muscle and the bone, that I can probably with reasonable certainty get a result that respects those tissue planes in a way that gets a good result. I think it's something that you have to figure out by doing. And certainly there are certain precautions that would be probably advisable when you have a consultation with the doctor. So learn more about structural volumizing and about this technique. And I think that there is hope for you to be able to achieve a look that's comparable to having a facial implant, but still be more customized. And that's a point that I should also make. The very nice thing about fillers is that you can really customize the volume, the placement, the level. So you can really mold it in a way like a sculptor so that you can get a nice result that fits your face at various levels so that you can get a nice natural look that can be pleasing and look right for you. So that's an additional benefit of using fillers. So I hope that was helpful. I wish you the best of luck. Thank you for your question.